Inside every blood bag collection kit, you will find all the materials required to perform a cord blood collection, in addition to detailed caregiver instructions. CPR's bag kit components are OSHA compliant and completely sterile, requiring no adaptations or additional tubing for use within the surgical field during cesarean deliveries. For your convenience, the blood bag has been pre-filled with dry anticoagulant. The cord blood should be collected as soon as possible, ideally within 10 minutes of birth. Clamp and cut the cord as close as possible to the infant. Starting at the fetal end of the cord, swab the area at the needle insertion site with betadine or 70% alcohol. Remove the protective needle cap at the end of the tubing by gently twisting and pulling on the cap. Insert the needle with the attached blood collection bag at the prepared insertion site. In order to collect as much blood as possible, try to minimize manipulation of the cord. Keep the bag at a lower level than the insertion site to allow blood flow into the bag. Watch the blood flow carefully. If the vein collapses, allow a minute for the vein to re-engorge and reinsert the needle farther up the cord. Swab each insertion site with betadine or 70% alcohol. If the placenta is expelled before enough blood is collected, or in the case of a cesarean delivery, place the placenta in a sterile pan and continue the collection. Be sure to access the fetal side of the placenta. Collection may be facilitated by keeping the collection bag lower than the placenta. After the blood flow has stopped, slide the safety guard over the needle. Immediately milk the residual blood in the tubing down into the bag. Clamp the tubing with the attached clasp as close to the blood bag as possible to prevent leakage. Cut off the needle and discard it into an appropriate container. Tie 2 secure knots in the tubing close to the blood bag to prevent leakage during shipping. Do not use sutures. Gently invert the bag several times to thoroughly mix the cord blood and anticoagulant. Place the entire blood collection bag into the plastic bag with absorbent pad and seal. Then place the bag into the insulated kit. Next, complete the section of the data sheet regarding the newborn and collecting physician and place it back inside the kit. The cord blood should remain at room temperature. Do not refrigerate. Provide the kit to the person designated for shipping. Patients are responsible for timely shipping of the kit and will be able to utilize our pre-arranged one-step shipping for their convenience.